Which of the following is the most appropriate next step in management of this patient? 60-year-old woman presents to the clinic with painless, slow-growing mass in her left parotid gland. She first noticed 6 months ago. Has a history of smoking but quit 5 years ago. On examination, the mass is soft, mobile, non-tender. Ultrasound reveals well circumscribed heterogeneous mass. FNA is performed. Cytology shows mixture of epithelial and lymphoid cells. All right. Left parotid gland. Definitely is cancer. Performed by the FNA. Let's see. Soft, mobile, non-tender. In the parotid gland. I don't know if you could do, I don't know if you take out the whole thing when she had smoking history. I think you have to, yeah, if it's slow growing, it's mobile, it's definitely mixture of those epithelial lymphoid cells. I don't know if you go right to, if you do radiation first. Or if you start resecting and do like superficial. I don't know if she needs the whole parotid gland taken out. Painless, slow growing, so it's probably still in the earlier stages. So might just be chemotherapy and radiation therapy at this point before. I don't think you can just observe and follow up. I think it is serious. I don't know if you jump to radiation therapy, which I mean to me makes sense to radiation and chemotherapy. So they're asking most appropriate next step in management. Maybe you do chemotherapy first. I'm not too sure for
Okay,
this
what's
type
your
of
gut
management.
answers?
Mobile, non-tender. If it's like immobile, I would do I would maybe chemotherapy here.
All right, let's talk about this question here. It's
Okay.
actually a superficial parotidectomy.
Okay.
Okay. And what the patient has is a Warthin's tumor, which is a
Okay.
benign tumor, a papillary cystadenoma lymphadenotosum, which you don't have to memorize. It's just a collection of papillary cells and lymphoid cells. Okay. Warthin's is benign. But the thing is, with
Okay.
Warthin's tumor, they can grow like, over time, they can grow. And then what can happen is it can, in theory, cause compression to the facial nerve. In theory, right? Even though
Okay.
it's benign. So while it's kind of small, you can do a superficial parotidectomy. Just means that you take the superficial standpoint of the parotid. Okay, which the
Okay.
barrier between superficial and deep lobe of the parotid is going to be your facial nerve. Okay, so everything superficial to the facial nerve, you take that parotid gland. So this is a benign lesion. So you wouldn't do chemo, you wouldn't do radiation. Total
Okay.
parotidectomy, you're gonna, it's usually for malignant tumors or things going into the deep lobe. So not here. You definitely don't want to do that for your Warthins. Observe and follow up can be considered sometimes for Warthins, depending. Let's say if they're too sick. Let's say they're 60 with a bunch of other medical history, right? And heart failure, kidney failure, can't go general anesthesia. Then this is technically a benign tumor, so you don't
Okay.
have to be super aggressive. But those that are stable and can undergo surgery, it's easier to take these out if they're small like this. So
Okay. That makes sense. So it'd just be that because it's the orthrins. Okay. And
exactly.
it's not malignant, so therefore that's why chemotherapy's out. But you wouldn't
Yeah,
do radiation therapy because it's so
no, chemo and radiation for the most part are for highly um high for cancer cells because they divide fast, right? So high mitotic
okay.
rates. And so they kind of target cells that rapidly divide, right? And so,
Okay.
with something benign like Warthins, you're really not going to have any kind of, the risk to benefit ratio of using these two big guns of cancer therapy, right, are not
Okay.
really included, right? Because you're going to cause a lot more harm than good here.
Okay. That makes sense.